Did you chip or break your front tooth? The first question, can it be quickly restored? The recovery time depends on exactly how it broke. Sometimes it's a small chip that can be fixed very quickly, but other times the damage is much deeper and it will take more time to restore. Now, let's look at 5 different scenarios of how a tooth can break. I'll tell you how quickly it can be restored and how much it will cost. Now, detailed timestamps will appear on the screen, so you can skip ahead to the specific case that interests you the most. The first case is the most common. As we can see in the picture, it's a chip on the edge of the tooth. This is also called the incisal edge. If you look closely, you'll see that this incisal edge is actually transparent. This means that it is very, very vulnerable and very thin. Such defects are, of course, typical for patients who like to crack sunflower seeds, nuts, bite threads with their teeth or other objects. Also, patients who, due to their nervous habits, tend to hold pencils, pens, or other foreign objects in their mouths. That's why the enamel is very thin, as I mentioned, and chips tend to form in this area. As for how exactly to treat them or how to restore them, they can be restored quite quickly. Just 1 or at most 2 hours in the dentist's chair is enough, and the patient leaves with a restored tooth. By the way, if you have a chip like this, give this video a like. The restoration is done using a regular filling material, specifically designed for this area, the transparent zone, so that we can recreate the most natural looking incisal edge with its ability to transmit light, making sure that no one can tell you have had a restoration or repair done. But despite all this, it's very important to understand that as soon as the doctor restores it for you, you absolutely need to give up all those bad habits. Otherwise, sooner or later, the chip will happen again.
In general, if someone has a chip like this, how necessary is it objectively for them to see a dentist and get it restored? It seems to me that a lot of people just keep living with it, sometimes for quite a long time.
Yes, that's absolutely right. I call this 2 types of patients. The first type of patient is the patient who gets a chip like this and immediately seeks medical help. Not because it's some kind of aesthetic defect, but because the enamel in that area after such a chip becomes very sharp, like glass, like a razor blade, and the patient starts injuring their tongue, even cutting their lip, and there's contact with neighboring teeth, an unpleasant kind of friction that the patient really feels. And of course, they immediately go to the doctor and show it. So in this case, it's almost impossible to avoid seeking medical help. The patient goes on their own. And the second type of patient, you're absolutely right, are those who walk around with this for decades. And not only does this defect appear on one tooth, but sometimes on neighboring teeth as well. And occasionally a single tooth can have 2 such defects at once, yet they live with it quite comfortably and it doesn't bother them at all. They say, I walk around, it's nothing serious. And it doesn't even bother them cosmetically, let alone physically. But the insidious thing about such defects is that, of course, sooner or later, the tooth is no longer whole, right? It's supposed to be whole, but it's already not whole. And of course, this chip, let's use the example of a car window, shall we? A stone hits the glass, and the sooner we start addressing that chip, because enamel is really like glass, that's even what it's called, enamel, the better. This chip appears, and it can simply keep spreading and breaking down further. And that's the minimum that can happen. That's why, of course, this is the tricky part. The chip will keep getting worse, and if, God forbid, there's contact with a neighboring tooth, the chip will grow, and then you'll definitely have to seek medical help will be needed, and the restoration will be more expensive and take longer, possibly even requiring a crown. And it might not even be enough to simply restore the tooth with filling material.
Are you sure you're not just trying to scare people? And objectively, do you really need to go to the dentist right away, or can you walk around with your tooth in this condition for a while?
A direct question about objectivity and whether I'm just scaring people. In general, everyone decides for themselves what to do about it. If it doesn't bother you at all, there are even patients whose enamel chip is not just like the one shown in the picture, but much larger, and it still doesn't bother them. Yes, of course, you can go about your life, just live with it calmly, but we are obliged to mention this and warn you that later, when it comes to restoration, or God forbid if caries develops in these chips, the tooth is no longer protected. Of course, this is a real risk. But again, as I said, everyone decides for themselves. I'm not urging anyone to run to the dentist right now. Yes, of course, I can't tell you what to do. Everyone decides for themselves. But as a specialist, of course, I recommend restoring such chips so that everything is as it should be. The second case, as we can see, is certainly more serious. Here, obviously, there is trauma. The person either fell or sometimes with this kind of chip, they bit into something harder. For men, It's wires, bottles, basically anything that's not meant to be opened with your teeth, we unfortunately try to open with our teeth. So here it's clearly traumatic. We call this traumatic origin. Yes, so the cause is already somewhat more serious. As for restoration in this case, basically the approach is the same. It will take no more than 2 hours in the chair. The doctor, in the same way, uses special filling or restorative materials. In fact, we generally call this kind of work the restoration of front teeth or filling of front teeth. And of course, we refer to it as artistic restoration. Even that's the name. You see, it's a beautiful one because the doctor really works like an artist, like a sculptor, building up your tooth, preserving not only the color but also closely replicating the shape, recreating, as I mentioned before, the incisal edge, that translucent part, so that the tooth looks natural. But still, it won't take more than 2 hours. You come in, the doctor will restore everything, and you can calmly go about your business, as they say. And this tooth will serve you for many years. As for the cost, specifically in our clinic, the price for such a restoration ranges from 6,500 to 12,000 rubles. The third case, as we can see in the picture, is more serious. Here, more than half of the tooth is broken, and if you look closely, you can clearly see that even the nerve itself is exposed. In other words, the inside of the tooth is out in the open. And such a tooth can no longer be restored with just a filling. Of course, such a patient, first of all, experiences pain during the trauma itself, and after the trauma will definitely continue to feel pain because the nerve is now exposed and unprotected. The patient will, of course, feel sensations from temperature, hot, cold, as well as sour, sweet, and salty. And these sensations will be very intense. It will be a sharp, acute pain. And of course, with such a tooth, it will be absolutely necessary to devitalize it or kill the nerve inside because there is simply no other way. So, as I mentioned before, we can already see on the X-ray that the nerve is exposed. Therefore, such teeth are restored in 2 ways. In any case, I have to tell you about both, since the first option is less traditional, but it does exist. We have seen this kind of restoration more than once, when such a tooth can be restored by a general dentist. What does he do? First of all, he treats the canal and cleans it, removing the nerve. In other words, his task is to devitalize the tooth, otherwise it will continue to cause discomfort. He removes the nerve, treats the canal, and places a fiberglass post inside. A post is essentially a small fiberglass rod, or more precisely, a stick that is placed directly into the tooth. And so it turns out it's like, a shovel in your mouth. The doctor places it directly into the tooth. The future tooth will then be built up on top of this post. So this is a kind of reinforcement. If we compare this to construction, it's like reinforcing the foundation when we build a foundation. It's the same thing here. We need to reinforce the structure, and the restorative dentist begins to rebuild the tooth. This is the first option. Why is this option no longer modern and not suitable according to current protocols? Because sooner or later, a rather large restorative part, in other words, you'll end up with a big filling on a large rebuilt tooth, a piece of tooth that will eventually break. But again, I want to emphasize that this option does exist, and a dentist can restore such a tooth with filling material. But as I said, this involves removing the nerve, cleaning the canal, and then sending the patient on their way. The cost of such a restoration will be around 15,000 rubles. In terms of time, it will also take no more than 2 visits to the doctor. So on the first day, they will treat your canals, and on the second day, they will calmly restore your tooth. Sometimes, by the way, this can even be done in a single visit, but it's best to spread it over 2 visits to observe how the tooth responds.
But in this case, isn't it possible to simply build up the tooth with a filling on top so as not to remove the nerve, so that you don't have to perform such complicated procedures on the tooth and just restore it the same way? Why is this option impossible, or maybe it is possible?
This option is not possible because there is a strict protocol. Anatomically, the tooth is structured so that it is protected on top by enamel, then comes the dentin, and then the nerve itself. Yes, that's right. We also call this the pulp chamber. As soon as, even during the treatment of a cavity, God forbid, if while drilling we break through into the pulp chamber, that's it. This is an indication. In other words, we have compromised the tooth's seal and sterility, you understand? That means everything must be completely cleaned out right away, because the sterility has been breached, the natural balance has been disturbed. As soon as a patient breaks a tooth like this and the nerve is exposed with all the inner parts open to the outside, then that tooth definitely has to be cleaned out, because infection is already present. That's it. It's impossible to just cover it with a filling from above. Or rather, it's possible. We can cover it with a filling, but the tooth will start to rot right under the filling. And most importantly, the patient will feel it. I think within a week at most, the tooth will become terribly inflamed, start to hurt a lot, and in the end, it will have to be removed altogether. That's why, once again, I say that a violation of sterility and tightness is simply an indication. In any case, this tooth will have to be removed. The tooth must be extracted, I apologize, so that it doesn't bother the patient anymore. The second option for restoration is a modern one, according to all international protocols. Also, as a mandatory first step, the canal is cleaned, the nerve is removed, the canal is filled, a fiberglass post is placed, and then the patient is referred to a prosthodontist. This is the specialist who handles prosthetics, and it is absolutely necessary to place a crown on this tooth. This crown is protective because a significant portion of the tooth is missing, so it will be restored on this post. We actually call it a core, so there will be a core, meaning the tooth is rebuilt on the post. But in order to prevent it from breaking in the future, it is absolutely necessary to place a crown when indicated. What is a crown? It is placed on your restored tooth, the one that has been rebuilt. So we broke it in half, treated the root, placed a post, restored the shape of the tooth, and now a protective crown, either metal, ceramic, or zirconia, is placed on this rebuilt tooth. At this point, you and your prosthodontist will decide together. Now, our tooth will last 100% for a very, very long time, possibly even for a lifetime. But most importantly, we will preserve it, and we won't have a repeat fracture or another chipping of this restoration that we've done. That's why such a tooth definitely requires prosthetic treatment. In other words, it needs to be protected with a crown. Of course, this will require more visits. That's at least 3 or 4 appointments. That means 2 visits to the therapist and 2 visits to the prosthodontist. So it will take, well, probably about 7 to 10 days. As for the cost, it will be around 35 to 45,000 rubles.
Why is it that if you put a crown on, the tooth won't break, but with a filling it might break off? But basically it's done more or less the same way, isn't it?
Well, actually, it's not more or less the same, since at the very least we're men and we have some technical knowledge, or at least basic knowledge of physics. In the first case, which I mentioned to you, fractures happen very often because, once again, physically speaking, that's just how it is. So if we put on a crown, the area of impact, meaning we protect the entire tooth, just imagine, and it's impossible to break the whole tooth. In other words, as I said before, physically, that's just not possible. But if we're talking about protection, that's just a little bit. Like if we shift it a bit, if we restore the tooth like this, so we've restored the tooth on a fiberglass post and made this kind of half tooth out of artificial filling material. So even imagine, even with this kind of protection, right? You put a crown on and try to break it. And now let's do it like this. We've restored the tooth. See, even on my hand, even for me, so this is pure physics, or rather, let's call it material resistance. If anyone ever studied pure material resistance at university, that's why it's very, 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 very important. That's why a crown, of course, protects the entire tooth much more reliably from fractures, from further damage. Actually, according to modern protocols, as soon as we treat a tooth endodontically, so what does endodontically mean? That is, as soon as we treat the tooth's canals, or, well, that's it. So the tooth is essentially dead. As soon as we start treating the tooth canal, the tooth is dead. Physically, it's dead. The tooth will certainly darken over time. Why do teeth darken there? Well, because he's dead. And according to modern indications, any tooth that has been treated endodontically, in which the nerve has been removed, is subject to orthopedic treatment. This means that a crown needs to be placed on such teeth. It's clear that we don't always do this, you know? So it's one thing how it should be, right? We only make recommendations to patients. And why are we talking about this? Because the tooth simply becomes brittle as soon as the tooth is treated and the nerve is removed. Again, the tooth is dead, the tooth is more brittle. It really becomes brittle, like glass. A living tooth is completely different. Which option and in which case is better to choose? Here, in fact, I have seen both therapeutic and prosthetic restorations. Of course, everything depends on the circumstances. If you are, for example, I myself lived for a very long time in remote northern regions where there simply was no help and there was only a general practitioner. And of course, in such cases, well, nothing terrible will happen if you restore the tooth this way, that is, without a crown. But if you live, say, in a big city and have access to prosthodontic care, then of course I would restore this tooth only with a crown. So once again, I want to say the decision is, of course, up to you. Be sure that any doctor, when you come in for a consultation, will make this decision together with you. You will weigh all the pros and cons. Always voice your doubts at any consultation. Ask a lot of questions, then the doctor will openly answer them and say, we can restore it on a post like this, but here are the risks, or we can do it this way. It's more expensive, takes longer, but it's more reliable. And only you will decide how you want to proceed. The fourth case, as we see in the picture, of course, this is a more serious case than all the previous ones. Here there is clearly a trauma, and a serious one at that. Most often patients say that they broke their tooth down to the root. Here we can see it ourselves. Or someone might even say, I broke my tooth below the gum line. Because yes, there is practically no tooth left. We see only small remnants of the tooth, or just the spot where the tooth used to be. And the first thing you need to do here is, of course, take an X-ray. Your dental professional will certainly need to perform an X-ray examination in order to accurately determine and assess whether the fracture in your tooth is limited strictly to the outer surface, or if the internal root structure itself has also sustained a fracture. In most cases, such injuries, of course, result not only in a fracture of the root itself inside, which we can't see, but sometimes even of the bone, that is the jaw, because once again, these kinds of injuries are very, very insidious and hidden. That's why an X-ray is absolutely necessary. So we've taken the X-ray and realized that, thank goodness, our root is intact and it makes sense to preserve it. In this case, the tooth is restored in a way similar to the previous cases. First of all, the dental nerve is removed from the tooth. Then the root canal is cleaned and disinfected. The canal is then precisely filled with a biocompatible material. And finally, a special post and core inlay is meticulously crafted. This is a prosthetic structure that recreates your tooth. In other words, we can't make it out of filling material like in the previous case, because that's too much filling material and it's unstable. That would result in a very fragile construction. But this one is cast from metal in a laboratory specifically for you to fit your shape. That's what a post and core inlay is. So if you compare it, it looks kind of like a grenade, with the handle here, and then this big part is your tooth. And this part, the handle, goes into the root. We insert it into the root, right? And this part here, let's call it the grenade, is actually your tooth, your future tooth, so to speak. It's made of metal, and the whole thing is fixed in place with a special glue, so it's secured right inside the canal. So now you have this kind of tooth, let's call it a cyborg, a metal tooth. And now the doctor will put a crown on top of this structure for you, specifically a protective one, to reinforce the entire construction. Again, the crown can be either metal ceramic or zirconia. This is something you and your doctor will decide together. But such a tooth can be restored using an orthopedic protocol thanks to the post and core inlay.
But what if, after all, we see on the X-ray that the tooth is broken or there is something wrong with the bone? What is done in that case?
In that case, of course, the root of the tooth is carefully extracted. That is, it is removed with a special instrument. This procedure is absolutely painless, as they say. The root of the tooth is calmly extracted, the socket is cleaned after removal, and ideally, an implant is placed there immediately. That is the ideal scenario. But otherwise, we remove the tooth, clean everything as well, place a hemostatic sponge or a collagen sponge in the socket, suture it, and then let the patient go, without the tooth, of course. And then he decides what to do next. Whether to restore the area with crowns by grinding down the neighboring teeth, or later on, once he saves up some money, get an implant, or even get a temporary partial denture, like a butterfly prosthesis. Here the patient makes the decision himself. But of course, ideally, the root should be carefully removed and an implant placed immediately. That's the ideal option. In general, when it comes to restoring with a post and core, that's possible. In fact, people still do it and it can be done. But as for me, if we're talking about myself, personally, with such a tooth and such trauma, I would of course have that tooth removed. I would rather just place an implant right away because it's quite a large structure. Just imagine such a bulky, heavy, massive structure hanging on such a small root. So there's always the chance that sooner or later we'll either break the root or injure it. That's why I would definitely get an implant, even if my root was perfectly fine. If you have any questions about implants, write to us in Messenger. The link is in the description. As for the time needed to resolve this fourth serious case of ours, well, it could take up to 2 weeks at most, fabricating a post and core, a crown, and treating the canals. And as for the cost, it will be around 50,000 rubles, definitely not less, I think. As for implantation, everything here is pretty standard. The patient comes in, we see the trauma, carefully remove the root, immediately place the implant, and by the way, in addition to placing the implant, we can also make a temporary tooth right away, which the patient will wear while the implant is integrating, yes. And this process will take 3, at most 6 months, and after 3 to 6 months, the patient will already have a finished tooth with a crown. So implantation will take up to half a year. The cost of restoring a tooth with an implant will be at least 75,000 rubles. And of course, this cost is spread out over this period, meaning you don't pay the entire amount at once, but after 6 months, the total cost should come to 75,000 rubles. Write in the comments which option you would choose, implants or a crown. The fifth case stands as one of the single most dangerous and exceptionally insidious. Here, the approach is the same as in the fourth case. To begin the diagnostic process, it is absolutely essential for us to take a detailed X-ray of the area. This is because, judging by what we see in the image, such a fracture often goes straight down or continues all the way to the root, effectively splitting the tooth right in half. So here, it's absolutely essential to look at the X-ray. And as soon as we see on the X-ray that our tooth is split in half and this crack goes all the way to the very end, of course, such a tooth must be extracted. If this crack hasn't gone that far and we only see it in the visible part, the crown portion of our tooth, right? That is, the visible part of the tooth that we see above the gum is the crown portion of the tooth. In this case, we can easily restore this chip and it will take no more than 2 hours. Everything else is the same. In practice, actually, there are patients who, after breaking a tooth like this, splitting it in half, either don't have it removed or don't seek dental care at all. I even have, let's say, an acquaintance like that, and I think everyone does, especially among men, people like this. This most often happens at a younger age, when during sports or fights, someone injures a tooth like this. The patient simply doesn't go to the dentist, or they do go, and the doctor tells the patient it needs to be removed, but the patient refuses. And of course, our bodies are so strong, they can recover from almost anything. And the patient really does walk around with a tooth like that. Yes, there is some slight mobility. Over time, even this mobility can, well, disappear, but the pain remains. Later, the tooth, let's put it this way, especially on an X-ray, you can see it very clearly. An inflammatory process develops, and even a cyst can form. But a patient can really walk around with a tooth like that. But we're talking about this as more of an exception. It's for those patients who say, yes, I had a fracture like that and I walked around with it just fine. I'll say it again, this is possible, but it's very dangerous, because if we ignore such a fracture, such a crack that goes deep into the root, if we ignore it, it's very easy not only to get inflammation of the tooth itself, but also inflammation of the entire jaw, because the inflammatory process, all the infection, just imagine, will travel up along that crack. And in addition to the fact that the patient experiences severe pain, it's really very painful, it's impossible to bite into anything. That's why this kind of fracture is so insidious and dangerous. This can easily be restored right at the dentist therapist's office in just 2 hours. I want to add, it doesn't matter what your case is, the first, the fifth, or the third. It's important, be sure to seek medical help. Go for a consultation. Let the doctor examine you and assess the nature, severity, and extent of the damage, and together you can calmly decide what to do. That way, both you and the doctor will feel at ease, and together you'll decide what to do about it. So take care of yourself and stay healthy.